It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest is Christina Julian, a doctor practicing interventional chronic pain management and anesthesiology from Acute Pain Therapies. We're talking about spinal cord and peripheral nerve stimulation. Basically ways to control pain in the spinal cord in the back.
It's a way to control chronic pain through spinal cord intervention or stimulation. I mean, it's very important. If you have chronic pain, I mean, you can control 5% of it. That's a big relief, Tom.
Oh, definitely.
Oh, yeah, pain is pain.
For a lot of people, for sure. All right, let's hear what Dr. Julian has to say with Shannon O'Kelly.
Dr. Julian, welcome to Health Talk. Thanks for joining us. How are you?
Yeah, I'm good. How are you this morning?
I'm doing great. Let's talk about kind of your practice. I always like our listeners to kind of find out, our guest, what they do, kind of what their interest is, and how you got interested. You're a trained anesthesiologist working in, is it fair to say, pain intervention?
Correct.
And so give us a little background on you.
Okay, great. So my name's Christina Julian. I'm an anesthesiologist, and I've done a fellowship in interventional pain management. So I primarily focus on the treatment of chronic pain via procedures, via medications, via injections. I'm currently at a private practice in Bellevue, Washington. We're called Acute Pain Therapies, and I'm partnered with another anesthesiologist who's a specialist in regional anesthesia, which means that he does a lot of ultrasound-guided injections. His name is Dr. Zachary Fisk, and I've been there for about a year now.
Well, I think our listeners, I would think a lot of people would assume when you hear the word anesthesiologist, I think the perception is you, as a physician, spend your time in the OR putting people to sleep, right? That's what you do. You put people to sleep for surgeries. But really, I mean, it's morphed into a broad kind of discipline. You just talked about your partner doing regional pain management. You do spinal cord pain management. Let's talk about that area and how it evolved. Kind of give us the genesis of pain management with anesthesiology.
Right. So correct. There are different specialties that go into pain management. I think an anesthesiologist to go into interventional pain management is kind of a natural progression because as anesthesiologists, we do a lot of hands-on procedures in the operating room, and we use a lot of ultrasound guidance and x-ray guidance to do those procedures. So it's just kind of a natural progression for us to transition from the operating room into an outpatient procedural-based practice because we have a lot of hands-on experience with that.
We've talked about in the past with other providers, interventional medicine, interventional pain management, and you just used the term ultrasound-guided procedures. Maybe set that up. I know on the radio, maybe you could describe what that means to our listeners because you're looking through an ultrasound machine guiding your needle, if it is, or the injection site. So you have a lot of good information now versus maybe 30 years ago when you kind of just did it by palpation and feel and knowledge. So talk about ultrasound-guided interventional medicine.
Okay, yeah. Years ago, I mean, most of these procedures were just done with feeling for landmarks, and everything was done blindly. But now with technology, we have ultrasound guidance, and we also have X-ray or fluoroscopic guidance. So ultrasound guidance is, what we use to take pictures of infants, right, fetuses when they're in the mother's stomach. It's a probe that we place on the patient, and we can see the different layers of muscle, the different layers of tissues, the bones, and we can actually identify the exact nerve that's our target. Alternatively, I use X-ray guidance in addition to ultrasound guidance. X-ray guidance just basically shows me the bones. And then anatomically, I know where to go in relation to those bones to do my injections to help with the pain condition that the patient is having.
So this is obviously, this technology and this use has obviously increased the accuracy and the injection site and getting right to the problematic area. Is that fair to say?
Absolutely. It's increased accuracy and it's increased efficiency and it's increased safety because we can actually see where we're going and we can avoid the things that we want to avoid, like blood vessels, or we can avoid actually touching the nerves, which we don't want to do because that would damage the nerve. So absolutely, it's made our job a lot easier and a lot more beneficial for the patient.
What is your area? We talked about spinal cord pain is kind of the area you focus on. Maybe talk about what does that mean to our listeners, spinal cord pain?
So spinal cord pain is basically when there's narrowing of the spinal canal that's putting pressure on either the spinal cord or the exiting nerve roots. And that can cause a variety of symptoms. It can cause numbness and tingling in the hands and feet. It can cause electrical shock-like radiating pains into the extremities. It can cause weakness because the nerves in the spinal cord, they like to be, kind of free-flowing. And if anything that's putting pressure on them can cause all of these symptoms. At most severe, it can cause weakness. I treat all the conditions related to spinal cord and nerve root compression.
We'll continue with Christina Julian and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our topic, spinal cord and peripheral nerve stimulation. We're talking with Dr. Christina Julian and Shannon O'Kelly.
Dr. Julian, again, thanks for joining us. Great job. We're setting it up. We're talking about spinal cord pain and some of the resulting factors of compression on your spinal cord or nerve root. This compression can come from bony growth. It can come from a soft tissue like a bulged disc. Your job is to find out what's going on and calm it down. Let's talk about some treatment options and what you do in the office.
Okay. So when I first see a patient, obviously I do a physical exam, and I'm going to need to order some imaging. An MRI is usually the most sensitive to identify spinal pathology. Then first line of treatment is always conservative therapy. So massage, physical therapy is a huge attribute and a huge help with chronic spine-related pain. Exercise, sometimes weight loss, sometimes even seeing a chiropractor can help. Medications are often useful. There are different classes of medications. There are anti-inflammatories, there are steroids, there are opioid pain medications, muscle relaxers, and nerve pain medications. If those kind of fail to help the patient, then we're talking about doing some sort of injections or procedures. Primarily in the spine, we talk about epidural steroid injections, which could involve a series of 1 to 3 injections to help decrease the inflammation of the nerves, to help resolve the symptoms or decrease the symptoms. Then finally, if that doesn't help, we're talking about a procedure called a spinal cord stimulator. And then at most extreme, possibly a surgical intervention.
Tell us about spinal cord stimulators, because I think our listeners probably right now are going, hang on, this nerve seems like it's hyperactive or it's irritated from some type of compression. Why would I want to stimulate it? You know what's going on there.
A spinal cord stimulator is basically when we implant electrical leads inside the spinal canal, just behind the spinal cord. And it delivers kind of a low-level, imperceptible electrical impulse to the spinal cord. It doesn't block the pain signals that are coming from the low back and the legs, but it kind of scrambles it so that the brain perceives it as different. The brain doesn't perceive it as pain, which it's been perceiving it as for years, right? It kind of scrambles that signal so that the patient doesn't perceive as much pain.
You're stimulating the spinal cord. There's so many pain receptors you have, and if you occupy a certain portion of those receptors, maybe the pain perception is diminished, or you're activating those so that it's not as intense.
Correct. And it kind of masks it.
Right.
So then the brain is focusing on the stimulation that's coming from the actual stimulator as opposed to the painful signals that the low back and the legs are sending to the brain. And these stimulators are incredibly sophisticated. It's an implanted device. So there are 2 electrical leads that are placed in the spine. And then there's a very small battery that's implanted in your back. It's charged. The programs are changed wirelessly.
Wow.
Or remotely. So it's a very sophisticated computer that's implanted where you can save different programs for different levels of activity. It's a very sophisticated technology now.
And usually you're going to use this technology later in the treatment. You're going to try some conservative care, and then the stimulator is there for an option.
That's what it's been historically, but now some physicians are advocating to do it earlier in the treatment cycle.
What are you seeing as results in your practice when you do put one of these spinal cord stimulators in? Pretty good results?
Actually, very good results. I mean, in the chronic pain world, nothing is going to take away 100% of a patient's pain, but I would see on average between 50 and 80% pain reduction with spinal cord stimulation in the appropriate candidate.
Wow, that's great. Thank you again for your time. Great stuff.
Yeah, thank you for having me.
All right, Shannon, as we talked with Dr. Julian, you can get more information at acutepaintherapies.com. Sometimes curing something or healing something is the best way to go, but you can't always do that, and so controlling pain becomes a big, big option.
Oh, it's huge, Tom. You and I both have experienced some pain in our life. Everybody has, and pain can be debilitating, and if you can eliminate it or control it, how wonderful is that?
All right, we're back with our next guest right after this on Como.